Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on molecular and cellular mechanisms of normal organ function with 4 answer choices and explanations. Molecular and cellular mechanisms of normal organ function clinical vignette. 1. Liver, hepatic detoxification. A 47-year-old man with a history of alcohol use disorder is found to have elevated liver enzymes. The cytochrome P450 system plays a key role in hepatic detoxification. Where is this system primarily located? A. Cytoplasm. B. Rough endoplasmic reticulum. C. Smooth endoplasmic reticulum. D. Golgi apparatus. C. Smooth endoplasmic reticulum. Explanation. The cytochrome P450 enzyme system in the smooth ER metabolizes drugs, alcohol, and toxins, affecting drug clearance and liver function. Glomerular filtration mechanism. A 65-year-old man with uncontrolled hypertension is diagnosed with chronic kidney disease. The glomerular filtration barrier primarily restricts passage of which substances? A. Positively charged molecules. B. Small neutral molecules. C. Large negatively charged molecules. D. Water-soluble vitamins. Answer: C. Large negatively charged molecules. Explanation: the glomerular filtration barrier, podocytes, basement membrane, and endothelium restricts large negatively charged proteins, e.g. albumin, while allowing smaller molecules to pass. D3. Pancreas, insulin secretion mechanism. A 16-year-old girl with type 1 diabetes mellitus has elevated blood glucose. Insulin release from pancreatic beta cells is triggered by which ion? A. Sodium. B. Potassium. C. Calcium. D. Chloride. Answer C. Calcium. Glucose uptake into beta cells increases ATP, closing K+ channels, leading to depolarization and Ca2+ influx, which triggers insulin release. Lungs, oxygen hemoglobin dissociation curve. A 22-year-old athlete undergoes high-altitude training. Which shift in the oxygen hemoglobin dissociation curve is expected due to increased 2,3-BPG bisphosphoglycerate production? A. Left shift, increased oxygen affinity. B. Right shift, decreased oxygen affinity. C. No shift. D. Curve flattens. Answer: right shift, decreased oxygen affinity. Explanation: 2,3-BPG reduces hemoglobin's oxygen affinity, promoting oxygen release to tissues, which is essential at high altitudes. 5. Stomach, acid secretion regulation. A 50-year-old man with chronic GERD is prescribed omeprazole. This medication inhibits which gastric secretion mechanism? A. H plus K plus ATPase in parietal cells. B. Pepsinogen activation. C. Gastrin secretion. D. Vagus nerve stimulation. Answer: A. H plus K plus ATPase in parietal cells. Explanation: proton pump inhibitors block the H plus K plus ATPase in gastric parietal cell secretion and treating GERD. 6. Heart, myocardial contractility. A 60-year-old woman with heart failure is prescribed digoxin, which enhances myocardial contractility by increasing intracellular levels of which ion? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Calcium. Explanation: digoxin inhibits the Na plus case ATPase, leading to increased intracellular Na plus, which decreases Na plus Ca2 exchange, increasing intracellular calcium and contractility. Brain. Blood-brain barrier transport. A 55-year-old woman is diagnosed with Parkinson's disease and is started on levodopa, L-DOPA therapy. Why is L-DOPA able to cross the blood-brain barrier? A. It is lipid-soluble. B. It uses a specific amino acid transporter. C. It binds to astrocytes. D. It is actively pumped by efflux transporters. Answer B. It uses a specific amino acid transporter. Explanation: L-DOPA crosses the blood-brain barrier via the large neutral amino acid transporter, ALAT1, allowing dopamine replacement in Parkinson's disease. 8. Skin, epidermal stem cells, and wound healing. A 30-year-old man sustains a deep laceration requiring stitches. Which layer of the skin contains stem cells for epidermal regeneration? A. Stratum corneum. B. Stratum granulosum. C. Stratum basal. D. Dermis. Answer C. Stratum basal. Explanation: the stratum basal houses epidermal stem cells responsible for regenerating keratinocytes after injury. And 9. Small intestine, nutrient absorption mechanism. A 45-year-old woman with celiac disease experiences chronic iron deficiency anemia. Which transporter is primarily responsible for iron absorption in the small intestine? A. GLUT5, B. DMT1, divalent metal transporter 1, C. Sodium glucose cotransporter, D. CFTR. Answer B. DMT1, divalent metal transporter 1. Explanation: DMT1 in duodenal enterocytes transports dietary non-heme iron into the bloodstream, and its dysfunction leads to iron deficiency anemia. Adrenal gland cortisol regulation. A 28-year-old woman experiencing chronic stress has elevated cortisol levels. Which enzyme in the adrenal cortex is crucial for cortisol synthesis? A. 11-beta-hydroxylase, B. 70-hydroxylase, C. 21-hydroxylase, D. 5-reductase. Answer: 11-beta-hydroxylase. Explanation: 11-beta-hydroxylase, CYP11B1, catalyzes the final step in cortisol biosynthesis within the zona fasciculata of the adrenal cortex. Key takeaways from molecular and cellular mechanisms. Liver. Smooth ER houses the cytochrome P450 enzyme system for drug metabolism. Kidney. The glomerular filtration barrier prevents large, negatively charged proteins from passing. Pancreas. Insulin release depends on Ca2 plus influx into beta cells. Lungs. 2,3-PG shifts the oxygen-hemoglobin dissociation curve right, enhancing oxygen release. Stomach. H plus K plus ATPase inhibitors, PPIs, reduce acid secretion to treat GERD. Heart. Digoxin increases intracellular Ca2+, improving myocardial contractility. Brain. L-DOPA crosses the blood-brain barrier via amino acid transporters. Skin. The stratum basal contains stem cells for epidermal regeneration. Small intestine. Iron is absorbed via DMT1 in the duodenum. Adrenal gland. 11-beta-hydroxylase is essential for cortisol synthesis.